recording. Okay. So for this upcoming week, what do we have? What's due this upcoming week in week 8? Who's looked ahead? What's due?
Case study and NCLEX questions and study for the exam.
Yep. Thanks, Marisol. Yep. So your case study is already uploaded. Some of you have already completed it. You have your NCLEX questions, and then I sent you several emails over the weekend with regards to the review sessions coming up this upcoming weekend, right? So it's the same schedule as the last 2 exams, 2 on Friday, 1 on Saturday, 1 on Sunday, all same instructor, same times. Okay, you have received your study guide 3 over the weekend, and so yeah. So I would start taking a look at that. I know, would you guys have any other exams this week, Peds or Med-Surg? No?
No.
Okay. What exams do you have next week besides community?
I don't think we got any.
Okay. Okay, great. So hopefully you guys can get to a review or 2, or, you know, that's always plan A. Plan B is to definitely listen to recordings, but it's always better if you can get to a live review. You've got your study guide. I would start taking after class today. You've got all the content information for this exam, week 6, 7, and 8. 6 and 7 were last week, 8 is this week. So all the information you need for the exam will have been covered. So then you can start to go through the study guide and connect the dots, right? Making sure you understand different concepts. The study guide's broken out in chapters, so it should be pretty easy to follow. Okay. And so what's in the study guide are important concepts that I'll be going over today for week 8. Okay. For those of you that are just coming in, if everybody could put their name in the chat, I'd appreciate it. Anybody have any questions? You know, well, week 9. So the last exam will be a week from today. And then I'll get that exam. It will be the same process as 1 and 2. I will get that ready for you to download over the weekend. Okay. And then I will encourage everybody as you go through, like I said in the announcement I sent you, go through the study guide, go through your notes, go through the reviews, listen to the recordings, do all that you're supposed to do. And if at that time, after all of that, if you still are having a hard time understanding any of the information, please reach out to me and we'll schedule something before the exam. Okay. Just by a show of hands, has anybody taken a look at any of the information I sent you with regards to week 8? Do you guys know what information chapters we're covering today? Okay, nobody. Okay. So let me just ask this question. It's week 8. Let me ask this question. Is there a reason that you guys don't preview the PowerPoints before you come to class and have a feeling for what we're going to cover in class, or become a little bit knowledgeable? I'm just curious for my own benefit as your instructor. Just to try and understand, get in your head and figure out why we don't do that up front, even though that's the expectation. Anybody?
I look over them. I know that we're doing disaster planning this week.
Uh-huh.
So I do at least know that, because obviously it goes along with the case study. So why wouldn't you look at the
Right.
PowerPoint to go along with the case study? That's
Mhm.
my thought process.
Okay. Has anybody reviewed in any of the prior weeks? Has anybody reviewed the case studies that I send you along with the PowerPoints? Do you guys review those at some point as you're studying for exams, or you do? Do you find them helpful? Okay. 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 All right. Well, just so you know, today we're going to be covering ethics, cultural influences, case management, disaster management, surveillance and outbreak, managing quality and safety, and then nursing practice at the local, state, and federal, national levels. So we'll start with ethics. The first two chapters, ethics and cultural influences, are chapters 4 and 5. And those come under the section in the book of influences in healthcare. So ethics and cultural influences certainly have an impact on healthcare. Tell me why. What is ethics? What is ethics? And why is it important in healthcare?
Ethics is like knowing what's the difference between, it's like knowing and doing what's between right and wrong. Like you have to know what's right and wrong. And I think it's important in healthcare because like what may seem right to us may be actually wrong to somebody else, I'm guessing.
Well, here's some questions to ponder. How would you protect a client's rights to privacy about their personal healthcare information? There's a question for you guys. How would you protect it and why? Are we held to certain standards in healthcare?
You're held to certain standards by HIPAA regulations.
Okay.
And I'm sure not everybody wants their issues or their health, disparities broadcast to every Joe, Bob, and Fred in the world.
Right. Here's something else to ponder. With regards to, say, assisted suicide. We are ethically and legally prohibited from assisting with the suicide of anybody and participating in acts of euthanasia. So what do we do when a terminally ill patient is suffering and asks us to help with an assisted suicide? What do we do in the high school clinic when a girl comes in and asks you where she can go get an abortion? What are some other ethical issues that you guys have been involved in your work experience? Or have you ever had an ethical issue?
Lying to somebody per family request about, a terminal diagnosis.
And how is that handled?
Well, that's when you get the social worker and, the physician and everybody involved.
Okay. Okay, a few things we need to know about nursing ethics. Okay, first thing we need to know is what are the ethical principles we are supposed to go by? Okay. I'm trying to get here. Hang on one second. Okay. Ethical principles and theories as guides to ethical decision making. That's where we're going to start. Page 53. Okay. Hang on one second. Okay, we're going to start with the ethical principles of utilitarianism and deontology. Okay. Okay, so you need to know about four different theories. Okay, and you guys can look these up. Okay, they're right here on page 53. The first one is utilitarianism, which with this theory, outcome is the key. Okay, deontology is the theory using moral rules. Okay, distributive justice, also known as social justice. What is the act? The theory is what kind of action that you're doing, will it create a burden on society? And then the last theory is consequentialism, which is the theory of what are the consequences of your actions. Okay, so those are your theories. Okay, the next area that we need to talk about is ethical principles, which is box 4.1. So we need to know each of these four. Okay, ethical principles are the respect for autonomy, which is exactly what it says, is we should be permitted to choose the actions and goals and choices that fulfill our life plans. Autonomy. Non-malfeasance is your do no harm principle. And then your beneficence principle is doing good. We do good, requires that we do good. The intention is that we do good. And then your ethical principle of distributive justice requires that there be a fair distribution of resources. Okay, fair distribution of resources to everybody. Okay. And here is, for all of you guys that are coming in, please put your name in the chat. Okay. The other kind, there are other different types of ethics. Okay, we've talked about ethical theories, ethical principles. We just went through, but there are some other kinds of ethics that we need to talk about. Okay, one is feminist ethics, virtue ethics, and care ethics. That's on page 56. Okay, basically, feminist ethics advocate for social, political, and economic. Okay, virtue ethics. The virtue ethics is about us flourishing as human beings, being the best we can. And then there's caring ethics, which is about relationships. Okay, so this is that section. Several other ethical theories are important to consider. Virtue is on page 56. Caring ethics is here. Okay. and then feminist ethics. Okay. So those three are different, three additional types of ethics that we should be familiar with. Okay. And then there's lots of great little boxes in this chapter about how to apply these kind of ethics. Okay. How to apply care ethics in the decision process. Let's go through that one. Let's do this. Recognizing that caring is a moral imperative. Identify personally lived caring experience as the basis of all relating to self and others. So relationships, caring for others. Right? We should be assuming responsibility and obligation to promote and enhance caring in relationships. Can somebody give me the example of when caring ethics, the decision-making process in caring ethics would come into play? Isn't it in your relationship of the patients who you're caring for, the clients you're caring for? You have an obligation to care, not only physically care, but emotionally, spiritually care for these patients. Here's another box, how to apply the feminist ethics decision process. Okay, so we know with feminist ethics, we're identifying social, cultural, political, economic, environmental, and professional contexts that contribute to a problem. Here's your CUSIN box. This is actually a good one. Client-centered intervention. That's what this competency is for this class. Or excuse me, for this topic of ethics. Right? The chapter discusses many ways in which understanding of basic principles of ethics can guide safe and effective nursing practice. Okay. Ethics and the core functions of public health nursing. Okay, this is applying our ADPI to ethics. All right, so we can go through each one with the assessment. Systematically collecting data on the population, monitoring the population's health status, and making information available to the health of the community. Okay. Policy development with regards to ethics. Right? Public health nurses, we know, are critical to the development of policies that reflect the preferences and goals of their constituents. Right? We nurses, we're in key positions to provide leadership in ethical issues. And then assurance. These are your core public health functions. Assessment, assurance, and policy development. Right? Assurance refers to the role as a public health nurse, making sure that essential community health services are available, including essential personal health services for those who would otherwise not receive them. So assurance that you have the care. Okay. And here's our objectives. And our objectives in this chapter are related to access to healthcare services. We want to increase the proportion of insured persons with coverage for clinical preventative services and increase the proportion of practicing primary care providers. Okay, so both talking about access. What's a code of ethics? What's our code of ethics? What is a code of ethics? Anybody? You can't be a nurse without operating within your code of ethics and being knowledgeable about it. So what is it? Nobody knows what a code of ethics is?
Set of rules you guide yourself on.
Ethical values, obligations, duties, professional ideals. Yes. It's your non-negotiable ethical standard. Okay, let's go through this. Box 4.3, the principles of ethical practice for public health. Okay, so public health and we need to know these. Okay, there's 12 of them. We'll go through the first couple. Public health should principally address the fundamental causes of disease and requirements for health, aiming to prevent adverse health outcomes. Public health should achieve community health in a way that respects the rights and individuals in the community. Okay. So you do need to have an understanding of these principles of ethical practice in public health. This is what guides us in public and community health. These 12 principles. And then we have our levels of prevention related to ethics. Primary prevention. Use the code of ethics for nurses to guide your nursing practice. Why is that primary? I really don't want to start calling on people. I really don't. And I don't want to listen to myself talk for 2 hours. So I really would appreciate some participation here from everybody, not just a few people. Why is that a primary prevention? What's on your screen? Okay, I'm going to keep moving on here. Okay, you guys go through those. If you don't understand why it's primary, secondary, and tertiary, then just let me know. Okay. Advocacy is really important in ethics. Okay, we need to have a good understanding about what advocacy is. Okay, what do you guys think? We practice as advocates all the time. What is advocacy?
Like speaking up for the patient, making sure it's done right for the patient.
Okay, what else is advocacy? Protecting the rights, health, safety of the patient. Okay. All right, so public health should advocate and work for the empowerment of the disenfranchised community members, aiming to ensure that basic resources and conditions are necessary for health and accessible to all. That about sums up what advocacy is in public health as a public health nurse. Okay. And then the next section talks about advocacy and healthcare reform and how we can be involved. Okay. The signing of the 2010 Affordable Care Act. That helped millions and millions of people out getting access to health care. Okay, so our takeaways from this chapter are a couple of things. You need to be aware of ethical, I'm just going to let you know so you can make sure you know your ethical principles, your ethical theories, your additional types of ethics, your feminine ethics, virtue and caring ethics, And then please also know about advocacy and ethics. Okay. Okay, let's move on to chapter 5, which is cultural influences. Let's ask a few questions here. Okay, so let's talk about number 2 for a minute. Recall a first meeting with a client that you've had. This is for you. This is a question for all of you. Recall a first meeting with a client whose culture differed from yours. Just think back. Did you form an immediate impression about the reason for the individual's contact with the healthcare system? Did you form assumptions? What led you to make them? How did your assumptions influence your interaction with the client or family members? So everybody's got an example of interacting with a different culture. Anybody want to share some experiences?
I had an interaction with an Asian patient and the way they used their Chinese medicines to help treat. That was interesting.
Absolutely. This chapter is all about cultural influences and cultural competence. What's cultural competence?
Knowing other people's cultures in order to treat and be there for the patient, I guess.
What kinds of things do you need to be working on culturally to understand different cultures? What actions could you take to be more educated? We'll go through this in the chapter. I'm just trying to figure out what you guys are thinking before we start this process.
You can ask questions.
Respect their beliefs.
Non-judgmental. Asking about their beliefs, asking how they would like to be cared for, asking if their family members are involved or not. Okay, we are in an extremely diverse culture right now, and you as caregivers are going to be working with numerous different cultures over your nursing career. Okay. Do you guys know which major ethnic and religious groups are in your communities? Do you know what resources are available to meet their needs in your communities? If you were asked to step up and help in your community, would you know the culture of what's in your community?
Yes.
I don't know, I'm just asking.
I would say yes.
Okay, good. Great. Awesome. Okay, let's talk about cultural influences in nursing and community health. Okay, there are a couple of groups that we want to talk about in this chapter. One is immigrant and the other is refugee. Many similarities, but a few differences. Okay. Page 80, page 66, let's see. Talks about immigrants. Okay, what are immigrants? What are immigrants? We know that immigrants have a huge impact on our culture, from the workplace to the classroom, in our communities.
Immigrants are people who come from other countries.
Yep. Okay. Okay, and we need to know what these are, the 4 categories of foreign born persons. Okay, right here. Legal immigrants, Second is refugee, right here. Those 4 categories. What's the difference between immigrants and refugees? What do you think? What kinds of, I think what we need to understand is maybe the situations that refugees have come from.
A refugee would come here for seeking a better home because they're in their home, let's say Salvador, they're going through a lot of violence. They can't
Correct.
live. An immigrant would come here for better living. They have options. They have more options than the refugee.
Right.
The refugees were more for protection, really, wouldn't it be?
Yes, that the biggest difference is the situations have come from. A lot of refugees have come from very war-torn countries, have had extreme trauma, right? Extreme circumstances, and they're seeking safety, right? They're trying to get away from persecution in their own homeland, right? So please know the difference between refugees and immigrants. And I think there's a box here. Here's what I need would be helpful to read about special note about refugees. It's on page 68. What I was just talking about. Unlike many of the immigrants, refugees have left their homes as a result of a disaster. May have led to significant physical, psychological consequences. Some may have been tortured. Others may have lost family members in horrible ways. Some may come from poor countries, and nurses, we need to be sensitive and help them find resources to help understand their needs. Lots of barriers, language barriers, not understanding our healthcare, not understanding our healthcare practices, not understanding simply our culture. Okay. And then we need to also be understanding the difference between culture, race, and ethnicity, right? So based on these 3 concepts of culture, race, and ethnicity, these 3 influence our understanding of human behavior. All right, we need to understand the meaning of each in order to be able to provide culturally competent care. Okay, so what's culture? Culture is your set of beliefs, values, and assumptions. Okay, about life that is wildly held among a group of people and transmitted across generations. So what is our culture? What is the culture you live in? What culture are you from? Okay. In your culture, you have the same language, the same same characteristics, okay, of the culture you live in, but everybody's from a different culture, right? So you have your culture, race, biological variation within populations based on physical markers. Maybe physical markers such as color, physical features, hair texture. People may be of the same race, but different cultures. Right? And the example the book gives is African Americans who may be born in Africa, the Caribbean, North America, or elsewhere. Okay. And then ethnicity, what is that? Shared feeling of peoplehood among a group of individuals as it relates to cultural factors such as nationality, geographic region, culture, ancestry, language. Okay. So your ethnicity represents some identifying characteristics. Okay. Maybe influenced by education, income level. Okay. Okay, cultural diversity, what is that? Cultural diversity refers to the degree of variation that is represented among populations based on a lot of things: lifestyle, ethnicity, race, interests, across place and place of origin, across time. Okay, so box 5.1, we need to study. You need to study. Okay, it goes through four different cultures: African Americans, Asian Americans, Hispanic, and Native Americans. And it goes through some variations based on your left-hand side, you have, for example, verbal communication. And it goes through each of the four cultures and how that culture views verbal communication. Okay, for Hispanics, with verbal communication, expression of negative feelings is considered impolite. Native Americans, low tone of voice is used, and the listener is expected to be attentive, and so on. Nonverbal. Okay, how's the family organized? What's their perception of time? That's always important. Native Americans are focused in the past, often past oriented. Hispanics are present oriented. The rest of them are present oriented, but Native Americans are past oriented. So if they're past oriented, what happens if they're asked to maybe schedule ahead a whole bunch of appointments, right? For, let's say, their family member had a stroke and they have all these physical therapy appointments that have to be scheduled ahead of time. Might they need some assistance if they're kind of focused in the past? Sure. If we're asking them to do something based on the future, they probably will need some assistance. Okay. What about, I'd like to point to this one as well. Alternative healers, Native Americans, they like to have a medicine man or a shaman. Okay, so what if they come to your clinic because somebody's ill in the family and they want to bring their medicine man in the room to a visit? Should that be okay?
Yes.
Why?
Permission from the doctor to do so.
Because that's
you want to
part of
make
that's their
medication-
culture.
But you want to make sure that the medication that they're using is not going to interfere with the medication that we're given.
Correct. And they're there as another set of ears and eyes for that family. That's their culture.
Yes, but they'll be allowed.
Yep, of course they'll be allowed. Okay. Self-care practices. Let's say you're doing home visits and you have these cultures and here are their self-care practices. Okay, it's just things to be aware of. You don't need to memorize these, but you have to be able to ask the questions. You have to become culturally aware, and that's what we're going to go through now. Okay, and again, you guys can go through your levels of prevention. Okay, and you can let me know if you have any questions about those. We should have a pretty decent understanding of levels of prevention at this point. Okay. And this goes through that chart, talks about each one, the different cultural variations with space, what that means, social organization, what that means, time perception, we just talked about that, environmental control, biological variations, and nutrition. Okay, culture, diversity, and social determinants of health. Okay, we know that we've been saying this all term, socioeconomic factors contribute greatly to understanding perceptions of health and illness among minority groups, right? Socioeconomic factors, so poverty. Okay. These groups may not have the opportunities for education and occupation, income earning, all right, or property ownership. right? Socioeconomic status, which is a measure often based on income, education, or occupation, is a critical factor in determining access to healthcare. Would you all agree with that? Absolutely. So cultural competence. Okay. So cultural competence in nurses is a combination of culturally congruent behaviors, attitudes, policy that allow us to work across a whole multitude of cultural situations, right? Cultural competence refers to our performance, right? So basically, right here, cultural competent nurses function effectively when caring for clients of other cultures. What does that take? Okay, here's your Healthy People 2020 goals. Please be familiar with those. Okay. How do we develop cultural competence? That's what the rest of this chapter is about. How do we develop it? Okay, developing cultural competence is one of the core competencies for public health nurses. Okay, it's an ongoing process that will evolve over your entire nursing career. I'm still learning how to be culturally competent. Okay, we all are. Okay. So it starts with, you can read through this, but there's several factors of attaining cultural competence. First one is cultural awareness, cultural knowledge, cultural skill, cultural encounters. This is how you become culturally competent. Cultural desire. Okay, so there's 5 aspects of being culturally competent. Those are the 5. Okay. This is an excellent summary. Box 5.3 is developing cultural competency, some points to remember. So please have a look at that box, 5.3. During each interaction with clients, be sensitive to the cultural implications of the encounter. Ask questions. When misunderstandings arise, acknowledge the problem, take responsibility. Right? Be knowledgeable about your own beliefs, about your own cultural heritage, biases, beliefs, values. Right? Try and avoid making assumptions. Okay. And as we talked about, understanding that developing cultural competence is an ongoing journey and an evolving process. Okay. And that was all I wanted to share in that chapter. Does anybody have any questions about why it's so important that we are culturally competent? We have to be culturally competent. We have to be. Okay. Okay, the next chapter is chapter 13, which is case management. Anybody know what a case management is, or what a case manager does? We've talked about it a few times. This is the actual chapter on it.
A case manager is responsible for setting up things such as oxygen or something that's needed for home care.
Okay, that's one example. A case manager is responsible for organizing and coordinating care. That's the overarching goal of a case manager. You are managing the case, and the case is a specific client. And as nurses, we may not be called a case manager, but we are case managing all the time. I can tell you in the schools, when I was in the schools and working with specific kids, I became the case manager without the official title. I was the one getting the parents involved, special ed involved, social worker involved when there were ongoing issues. We're just naturally the coordinators of care. Okay, but there are official titles of case management in every type of nursing. Okay, so let's say you're a case manager and you are organizing, you are organizing the discharge of, a patient who has had a triple bypass. Okay, and you're the discharge case manager of all those patients on the cardiac floor. Okay, you are going to be responsible. There'll be a protocol in place, but you will manage that discharge process. And so who might you have to involve? What might those services what services might that client need at home?
Home health,
Home health?
cardiac rehab,
Durable medical equipment.
Yeah, medical equipment, oxygen. Can't send a patient home from the hospital on oxygen with no oxygen at the home ready to transfer to. Right? Can't send a triple bypass patient home without a plan for cardiac rehab. Right? Do you know, do they live alone? Do they have family members that can cook for them, that can get them to appointments initially? That's what a case manager does. You coordinate, you organize care. Okay. Okay, here's a formal definition. Case management is defined in public health nursing as the ability to optimize self-care capabilities of individuals and families, and the capacity of systems and communities to coordinate and provide services. So that's the fancy way of saying a case manager. If you're the case manager for stroke patients going home, if you're the case manager from rehab patients going home, right? Who is going to be your key components that you will need to communicate with depending on your needs assessment, right? Obviously, a needs assessment has to be done, and that's what the case manager's job is. Okay. What we're doing when we're case managing is also called advocacy. Okay. So this chapter discusses how advocacy is used with case management. Here's your Healthy People 2020 box on page 224. Okay. Here, this is an excellent box, 13.1. This is the nursing process. This is your ADPI in case management. Okay. It takes all of your mnemonic of ADPI and translates it into the case management process. Okay. So I've told you all along this term, you have to be able to apply ADPI to all of these different topics. Here it is laid out beautifully for you of how to apply your ADPI to case management. And you may get asked a question on your next exam, given you a scenario in the nursing process and asked what activity would be happening with the case management process in, say, diagnosis or assessment. Okay. So again, you really don't need to, this should click. You should be able to understand what an assessment task is with regards to case management. Okay, or what a diagnosis task is or activity based on diagnosis. Okay. So we know that case management is labor intensive, time consuming, and very costly. All right, but we know that we have so many complex health issues, chronic diseases, that we really do need case managers to coordinate the care. Okay. Here are some of the roles that a case manager might have. Box 13.2. Okay, broker, which is the fancy way of saying you are an agent for providing services that are needed by the client, right? And you are also responsible for making sure they stay within the coverage of the health plan. You may be acting as a consultant, a coordinator, an educator, facilitator, liaison, and so on. So understand what these different roles are. Lots of different roles that the case manager may assume. Your liaison role, providing a formal communication to all the parties involved. Okay, this is another area that we should be familiar with is what kinds of cases, what kinds of diagnoses, what kinds of diseases would be case managed. Okay, remember, think about all these bullet points here. Okay, what do all these bullet points have in common? Are they going to need maybe one service or multiple services?
Multiple.
Multiple, which is why you need a case manager, right? Because we already said the case manager is the coordinator of the care. So if you're asked a question about what types of diagnoses or conditions might require case managers, you should be looking for answers that are clients that have multiple needs. Okay, not a woman who's pregnant that needs to schedule OB appointments. Maybe a teen pregnant mom may need a case manager. Maybe somebody with mental health issues and addiction issues at the same time may need a case manager. Okay, maybe a terminal illness may need a case manager to pull in hospice and home care, right? And then I'm going to have you guys read this section on your own. This is advocacy, okay? The first essential skill for case managers is advocacy. Okay? And here's your definition. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, and communities and populations. Excellent definition of advocacy. But I would like you to read through this section. Okay. And again, you can see up to box 13.2. It's an excellent summary of your ADPI, your nursing process, and the advocacy process. Okay, so if you're asked about, given a scenario and said, which part of the nursing process is the nurse performing? If she's making decisions, supporting the client, assuring and reassuring, which part of the ADPI is that? Implementation. Okay, so there's a good summary of your nursing process. Okay, that's all I want to cover for that chapter. Next chapter is 14, disaster management. And last night I went through all of the case studies with these 8 chapters, and they're actually really, really good. Okay, so the case studies I sent you over the weekend, the rationales are excellent. Actually, the rationales are excellent for all of the case studies, but this in particular, disaster management case study is a real good one for knowledge. Okay, what do we want to know about disasters? Okay, there's 2 types of disasters. It's either natural or man-made. Okay. We know that disasters causes disruption, destruction, or devastation. Can affect a single family, small group, a whole community. Okay. Floods, economic losses in the millions with floods, earthquakes, tornadoes, hurricanes. Okay, so here's your types of disasters. There's natural and human-made. So please be able to identify which type of a disaster we're talking about, if it's natural or if it's human-made. And that is in box 14.1. How do you tell the difference?
Human-made would be bioterrorism, something like that. Natural would be hurricanes, earthquakes.
Yep, human-made disasters, warfare, conventional warfare, fires, train derailments, right? Hazardous material incidents, pollution, civil unrest, terrorism. Okay. Okay. Couple things we need to know here is Department of Homeland Security was created in 2002. Okay, and there are a couple of divisions within the Homeland Security that are going to be participating in disaster management. Okay, and the first one we need to know is these are definitions. Okay, so we need to know the definition of or the services they provide of the NPG. And you can read what it is. It's all in here, this chapter or this paragraph. It's the preparedness, the National Response Framework. How does the community work together? How the whole community works together and how response efforts relate to other parts of the national preparedness. Okay, and the National Response Framework has 5 missions. It covers 1 mission area: prevention, protection, mitigation, response, and recovery. That's what we need to know about the National Response Framework. And then we need to know what the Emergency Support Function 8, public health and medical, what they do. Okay. So those are a couple of key agencies that will be important to know about in disasters. Okay, we do need to know about the Healthy People objectives for disaster management. Okay, so that would mean that you would need to read this right here. Okay. So because disasters affect the health of people in many ways, they have an effect on almost every Healthy People 2020 objective. Okay. Disasters clearly affect the objectives that relate to unintentional injuries, occupational health and safety, environmental health, food and drug safety. Okay, so keep reading through that. Okay, talks about bioterrorism, the importance of disaster preparedness. What's our role in disaster management? Okay, we need to know that there are 4 stages in disaster management. Prevention, preparedness, response, and recovery. On page 238. And you'll need to study what are those 4 stages and what do each of them entail. But we know that nurses are expected to be able to work within all aspects of each of these 4 stages, right? With all of our ADPI skills. They would expect us to do assessment, priority, education, triaging, right? We can do rapid needs assessment. So we're involved in all 4 parts. And here's a summary of your Healthy People 2020 right here. 239. We do need to know these for this chapter. And they're excellent objectives: improve the utility, awareness, and use of existing information systems. Reduce infections caused by key pathogens commonly transmitted through food. Right? Increase the proportion of crisis and emergency risk messages intended to protect the public's health, and that demonstrate use of best practices. And increase the percentage of children and adults who are vaccinated annually. Then it goes through each of the 4 stages and how each of those are handled. Prevention, preparedness. I'm going to stop here in preparedness. How do you be Red Cross ready? We need to know this, because you're going to play a huge part in community nursing, public health nursing, and how do you prepare families to be ready for a disaster? So this tells you how to be Red Cross ready. Okay, 3 parts: get a kit, make a plan, get informed. You need to know this information here, in case you're given a scenario that you need to prepare a family and help them put together a kit. What do they need to know? Storing at least 3 days of food. Keeping extra supplies on hand. The kit has to be easily accessible. Remember to check every 6 months for outdated or expired items. Do families know in their plan? Does everybody know how to turn off utilities? Okay, so we need to understand how to be Red Cross ready. Okay. Box 14.2, bioterrorism and emergency readiness. What are the competencies we need? Okay, pretty self-explanatory, but I want you to read through that. First and foremost, what's your role in emergency response? Do you know what the chain of command is? Do you know where the emergency response plan is? Who in the working world has not participated in disaster drills? So everybody participated in disaster drills, emergency management drills. Yes?
Yes.
Yes.
I'm assuming you should be. I mean, that's best practice at this point. Okay. Okay, and now the level of community preparedness, right? It's only as good as the people and the organizations in the community are doing. What are you doing? If you're the community health nurse, public health nurse, what are you doing to prepare the community for a potential disaster? Do you know in your own communities, if there's an impending disaster, do you know what the communication system is? I don't know. Do you have a disaster plan for you and your family? Red Cross Ready disaster plan.
Mm.
Okay. This is one of the agencies we talked about above, but it goes into more detail about them here. We need to understand about the National Response Framework, the NRF. Okay. The NRF focuses on response and short-term recovery. Okay, it helps define the roles, responsibilities, and relationships critical to effective emergency planning, preparedness, and response to any emergency or disaster. So that's an important one to know. They're going to play the biggest part. And I believe they are under FEMA. Everybody know what FEMA is? What's FEMA? Boy, you guys are quiet today. What's FEMA?
Federal Emergency Management.
Yep. Okay. And then the last part I want to cover in this chapter is box 14.5, tips for survivors of a disaster or other traumatic events, managing stress. Okay, as a nurse, you may be also part of the recovery. Okay, trying to get or facilitating the transition back to the new normal. Okay. And so you also have to take your own health, mental health into consideration as well. Okay, that's box 14.5. And this is not only for the healthcare providers, but any survivors of a disaster. Here's what you might be dealing with. Okay. And then box 14.6, what are your populations at greatest risks for a disruption after a disaster? Why would some of these populations be listed? What do you guys think? What if it's a lack? What if it's the disasters impacted the water supply? And you have pregnant women. Might that be an issue?
Yeah.
Yes.
Yes, of course. Children, yes. What if you've had a disaster in which a tornado in which the town's gone, the pharmacies are gone, and you have people with diabetes that need insulin? Okay. Lots of different scenarios, lots of populations at risk. Okay. Next is surveillance and outbreak. What is surveillance and outbreak? What's the difference between observation and surveillance? Let's talk about that. What is disease surveillance? Ongoing systemic collection, analysis, interpretation, and dissemination of health data to be used in the public. Okay. So surveillance provides a means for nurses to monitor disease trends to try and reduce morbidity and mortality. Okay. Okay, here's some uses of public health surveillance. Surveillance can be used to facilitate the following. We can estimate the magnitude of the problem. What is the geographic distribution? What's the natural history? Is it an epidemic? Is it reaching epidemic state yet? What are we going to do to stop the spread? What control measures can we put in place? Okay. So what's the purpose of surveillance? It helps us to identify trends, right? Trends, unusual disease patterns, set up. I would think of COVID. Just think of COVID. Okay, set priorities for using resources, develop and evaluate programs for, think of what we're doing with COVID, for testing, for keeping kids out of school, right? So I'd like for you to read this here, this 256, this paragraph that starts with surveillance activities and how surveillance activities relates to the core functions of public health. Remember, the 3 core functions of a public health are assessment, policy development, and assurance. Okay, so this paragraph talks about how surveillance activities works with or is attributed to the core functions. Okay, I'm not going to read that out loud to you. You guys can read that. Okay. What are some nursing competencies that we need to have with regards to surveillance? Okay. We need to be able to have analytic assessment skills, good communication, community dimensions of practice, basic public health science skills, and leadership and systems thinking. Those are the 5 competencies, core competencies we need to have as public health nurses with regards to surveillance or investigation. And so I think of my 1.5 years in the schools doing COVID. You know, I turned from a school nurse to a COVID nurse. Okay. And I had to have all 5 of these competencies, and all 5 of these competencies and every single bullet point under each of these 5 competencies was practiced on an ongoing basis. It's a real life example. That's all I did for 1.5 years was right here, 1 through 5 and all the bullets in between. That's all I did for 1.5 years with regards to COVID. Okay, our Healthy People 2020 box with regards to surveillance. Okay, please be familiar with the 6 of these. Okay, now a couple things we need to understand about surveillance. Okay, first thing is, what are some types of surveillance systems? Okay, so we already know that they're designed to assist public health people for early detection of a disease and outbreaks, to intervene, reduce the potential for morbidity and mortality. Again, think COVID, if we want to put this all in perspective. You need to know the difference between a passive system. There's 4 systems. Passive, and they're here on page 260. Passive, active, sentinel, and special. So in school nursing, actually, I'm going to read you, there's an X on your, anybody have the study guide in front of them? So you know what I'm going to do? I'm going to direct you back to your study guide. In the section of surveillance and outbreak, there is a bullet point that describes these 4 systems. It has a definition for each of them. It's a good succinct definition for each one of them. But basically the passive system would be me as a school nurse reporting to the health department that we have a case of pertussis in the elementary school. Okay. Active, then that health department nurse then takes my information and starts to look at other cases in the school. Okay. And then the next system is the sentinel. Okay, that is where health, our healthcare, our doctors and other clinics reporting the same problem or pertussis or COVID. Okay. And then your special systems is a combination of active, passive or sentinel. So where's the information coming from? Is it coming from people reporting to the health department and then the health department seeking out additional information? Is it coming from hospitals, doctors' offices, clinics that are calling in as well? Okay, so that is 4 types of surveillance systems. The next thing we want to look at is patterns of occurrence. Okay. Page 261, what are the patterns of occurrence? Patterns of occurrence are identified when investigating the disease or the event. Right? So the patterns are used to define the boundaries of a problem, to help investigate possible causes of a problem. So there are 5 patterns of occurrence. There's a common source outbreak, which could be, the example that's given is a gas being released into a underground subway car where everybody's exposed and everybody gets sick. Okay, point source. Okay, all persons exposed become ill at the same time during one incubation period. And then there's a mixed outbreak. Mixed outbreak could be the flu. Person-to-person contact. Over an ongoing period of time. Then the next is the intermittent source. So that could be, say, a food poisoning, right? Where people may be exposed over a period of days or weeks, as in food poisoning, or, at a restaurant chain, right? Let's say the restaurant purchased bad lettuce and it's served over a period of time. People will get sick at different times. And then the propagated outbreak does not have a common source, and it usually spreads from person to person over more than one incubation period. And so the example we use for the propagated is, say, TB. Okay, so please have an understanding of those patterns of occurrence of outbreaks. Okay. The next, last part of this is when we're developing, here's our primary, secondary, and tertiary. For surveillance activities. Okay. Please go through those. If you don't understand why these are primary, secondary, and tertiary, let me know. I wanted to cover, where are, okay, I want you to there are, as you're developing community-based programs, you need to do a needs assessment. Okay. I want to bring up, let me go to the study guide here. Because there's an excellent surveillance. Right here. I'll review these two right from the study guide. So with regards to surveillance and outbreaks, when developing our community-based programs, we'll have to conduct a needs assessment. There are stages of the needs assessment that we need to adhere to. Okay, and you need to know what these are. They're and if you don't understand this on the study guide, please go back to the book in this chapter. There's a preactive stage, the reactive stage. Okay, the preactive stage, we project future needs. Reactive stage, we determine the problem occurs using past identified needs. And then there's an inactive stage, which defines the problem based on existing health status. Okay, and then there's the interactive stage. Okay, so we need to understand the 4 stages of, first, obviously, is the needs assessment, right? And then what the stages are of developing the community-based programs. Okay. So there's your 4 stages right there. So then there's a couple of models that we would put in place with the community. Okay, a couple of models we could use as we're doing surveillance and observation. Okay. The first model is the patch model. Okay. In this model, we are mobilized. We want the community to act with us. Okay. We want the community to help with the needs assessment, choosing priorities, choosing issues. Okay. The next model, it's called the APEPH model, the Assessment Protocol for Excellence in Public Health. Okay, this model focuses on assessing and setting priorities for health problems. Okay, you need to know the difference between these 3. And then you have the MAP, MAPP, Mobilization for Act Through Planning and Partnership model. Okay, and that's long-range planning. Okay, so those are your three models that we could use with surveillance. Okay, so I'm taking this right from the study guide. Okay. Oops. Okay, let's jump to 17, managing quality and safety. Okay, I know that we practice quality improvement, quality assurance, all that is practiced in the hospital setting, clinical settings, right? But is also practiced in the community. Okay, so how do you manage quality and safety in the community? Okay. First, we need to understand the differences between continuous quality improvement and quality assurance. Okay. Quality assurance is essentially, it's assuring quality. So quality, every place you work has a quality assurance department. Do they not? Okay, so continuous quality improvement is exactly what it says. We're continuously trying to improve our performance based on the feedback we get. Quality assurance, okay, is the assurance that quality care is being provided. So that comes into play if there's an issue, there's been a mistake or an accident. We don't need to go through the history. Okay, so under continuous quality improvement, right, how can we, give me some examples of how we can gather information to constantly improve our hospital experience for our clients? What could you do? Could you send out a survey after they've been discharged?
Yes.
Could you do a follow-up phone call? How was everything? What kinds of ways could we gather information? What other ways?
Surveys,
Pardon me?
surveys?
Service meaning, what do you mean?
No, surveys, like,
Surveys,
surveys.
yeah, exactly. Yep. Having them fill out surveys while they're in the hospital, sending them surveys when they get home, doing follow-up phone calls. How was your experience? And how important is it for us as healthcare workers to know what the results of those surveys are? Because don't we want to be participating in the continuous quality improvement of our organization? Don't we want to know what the clients expect of us? Did we meet their expectations? Did we not meet their expectations? And if we didn't meet their expectations, why didn't we? I mean, do we all go to monthly, annual trainings on improving quality, improving patient satisfaction, whatever you want to call it? Improving patient hospitalizations, improving customer service. Has anybody not been to in-services about that? And so if you get down to the how-to box on page 280, it gives you the differences between quality assurance and continuous quality improvement. Okay, so we need to know this. Okay, the one big focus, I'll do quality improvement first, right? We're trying to figure out what our deficiencies were. What were the expectations that we missed or met? What are the opportunities we have? We're all responsible for continuous quality improvement, right? If we're all in it together to make it a better experience, then everybody wins. That's continuous quality improvement, where quality assurance actually happens after something has happened. So let's say there was an accident in the OR. I don't know, there was an accidental death in the OR. Okay, the quality assurance team has to investigate that, detecting errors, fixing blame and responsibility, post-event investigation. That's the big difference. Okay, does that make sense?
So I have a question. So like, I know like we do like little surveys on my unit in the hospital or whatever and whatnot. Like now, how do you go about that as far as like community wise to see like if your care was effective or whatnot, you know?
Well, the same way. I mean, whether the home health nurse or, you know, leaves a survey at the house or whether they're sent a survey in the mail, it would be the same type of gathering information just in the community setting. Right? So instead of calling a patient in the hospital, you maybe calling a patient after a home care visit or after a wound care visit. Does that make sense? It's the same process, just in a different setting. Right? Let's say you're doing education programs in the community. Right? Let's say you're doing a talk with diabetic patients or obese students, and you do a survey at the end of your presentation. How was it? Did you meet the needs of, did you meet your goals and objectives? What did they think of it? Does that make sense, Catherine?
Yes, ma'am.
Is that you out? Did you ask the question?
No, it's me, Monica.
Oh, I only can see 3 people.
No.
Monica, does that make sense
Yes, it makes sense.
of how you would gather information in the community setting?
Yes.
Okay. And then here's what we just talked about. Customer satisfaction for both internal and external users can be assessed through the use of focus groups, surveys, response cards, right? In your organizations, are your leaders always trying to motivate you and provide you continuous training opportunities to learn how to be better people, better employees, better caretakers, better at customer service? Right? Okay, I want to talk about the tracer method. Okay, the tracer method is it's a measure of both process and outcome, okay, of care. Okay, it's the method is more effective in evaluating the healthcare of groups of individual clients. So here's an example. So here's an example of who could participate in the tracer method. Okay. Groups that are selected for the tracer outcomes, studies in nursing, they all have to have 6 of the same things. Okay. So for example, let's say 5 institutions across the city are studying the effects of post-surgical triple bypass patients. And they're going to participate. So there's 5 groups of people at 5 different hospitals, and they're all going to do the tracer method, right? But here's what you have to have, 1 through 6, right here on page 286. You have to have the same disease, the same intervention, the same needs, be located in the same community, similar lifestyle, and be at the same illness stage, right? So if you do this with different groups at different hospitals, you can show the differences in outcomes, a result of your nursing care standards. So let's say a hospital is able to discharge a patient in 3 days, and the rest of them were 4 days. What is the safely? What is the hospital doing that's discharging in 3 days that's different? Does that make sense? So it's kind of best practice, evidence-based practice. And a tracer method is a very common method we use for data collection. Okay. Okay, the phases. Now I want to go through the phases. Okay, we need to go through the phases of a developing a program. Okay, and here's a good visual right here on page 286. It involves the structure, the process, and the outcome. Okay. Okay, so the structure. In the structure phase, we're identifying values, which is the first step of a quality assurance program. Okay, defining the needs, the beliefs about the agency. Okay. So what is the structure of the agency? What is the philosophy? What are the objectives? Okay. Then what is the process? Right. So the evaluation of the process standards is a specific look at the quality of care being given by the agency, such as the nurses. Okay. So primary approaches used for process evaluation could be, say, peer reviews. Have you ever been asked to participate in a peer review? Well, you just were in your group project. Have you ever been asked to participate in a focus group? Given questionnaires? Okay, and then the outcome. How do you evaluate the outcome? The evaluation of the outcome standards is a result of the nursing care is one of more of the most difficult tasks. Right? Identifying changes in the client's health status that results from nursing care provides nursing data that demonstrates the contribution. Okay. And we just talked about research studies using the tracer or sentinel method to identify client outcomes and client satisfactions can be used to measure outcome standards. Okay. And from all this data, okay, from structure, process, and outcome phases, we can gather what our strengths and weaknesses are in the way we deliver nursing care. And here's a good example of some issues that could potentially be studied in a quality assurance program, which remember, it's the result of an accident or an injury. Here are the kinds of things that are studied: client death, client injury, ineffective service, patient complaints. Okay. So those are some ways to manage quality and safety in the community setting. And then we jump down to our last chapter, which is 28, which is nursing practice at the local, state, and national levels. Okay. And I'm going to have you, a couple things we need to know in here. Okay. What are the differences? What are the differences between local, state, and federal public health agencies? Here on page 499, it tells you what the federal public health agencies are responsible for. I'm going to go through this quickly because I want to do the attestation questions. And then the state public health agency, I've highlighted here on page 499. And then local public health agencies. So have an idea of what each are responsible for. Levels of prevention. Look at all the examples here. This is a good box to review. This gives you lots and lots of examples. 642. It's related to public nurses in public health. Page 503. Please review this. Gives numerous examples in each one. Okay. So please review that. Okay, in this chapter, they talk, oh, here's Healthy People 2020, right? And their objectives are related to the public health infrastructure. There's 5 goals. Just be familiar with those, please. And again, functions, we've already gone through this earlier today. Functions of public health nurses. We talk about an advocate here. We talk about a case manager. Goes through all the different roles, but we did touch on these 2 earlier. Functions of public health nurses. Remember that whole list they gave us? Okay, I need to find a couple of things in here. We need to talk about liability. Okay, there's a 3 standards that you need to meet with regards to liability. Okay, we did the, hang on, thought I had this highlighted, but I don't see where my highlights are. I'm not finding it. This is in the, let me jump to the study guide. Because it's in here, right here. Okay. So liability concerns for case managers, okay, exists when the following 3 conditions are met. Okay, so this, we're talking about malpractice. Okay, and this is coming right from the study guide. There's 3 things that have to be met, okay, in order for malpractice to have occurred. The provider had a duty to provide reasonable care. The breach occurred through an act or an omission to act. And the act or omission caused injury to or damage. Okay, so this actually should be in the case management section. I'll make sure that gets moved. That's why I couldn't find it. Okay, and then the other thing I want you to know about government, the law, and policy activism, we need to know about the Shepard-Towner Act of 1921. Okay, and what role it played in public health policy and public health nursing. Okay. Okay, this was developed, it created standards for early developmental screenings for kids, provided health services to women. Okay, so this was an act that really got the women's and infants, women's and children's care going. Okay. And then the other part I wanted to cover was the World Health Organization. Remember, if you're asked about the World Health Organization, is this a global, federal, state, or local organization?
Global.
Global, right? We need to know about the World Health Organization. What's their goal and what services do they provide? Okay, their goal is to attain the highest level of health, highest possible health for everybody, for all persons. That's global. And then the rest of this describes some of the services they provide. Okay. And then another agency that we need to be familiar with, or a few of them, this is more of a definition paragraph, is the Agency for Healthcare Research and Quality. There's several in this paragraph right here. Okay, there's 4 of them. This is definitions. Okay, this is right on your study guide. Okay, so what are these for? National Agency for Research and Quality, CDC, Health Resources and Service Administration, and the NIH. Gives you exactly what each one of them are. Okay. And then the last thing I'll focus on with regards to government and policy activism is I want you guys to be familiar how the goals of healthy people started in 2000. Okay. Started in 2000 and now we're at 2020. Okay. You need to be familiar with how those goals evolved. Okay, so basically it's right here in this paragraph here. So basically the first set of goals in 2000 were very basic and just simply focused on increasing years of life. Okay, increasing simple things, increasing years of life, reducing health disparities, improving access to preventable diseases. And now we need to look at how that same goal has evolved 20 years later. And the message is it's become more specific. It's focused on more descriptive outcomes. So now instead of increasing years of life, we want to attain a higher quality life. Reducing health disparities. Well, now we want to live free of preventable diseases. So I just need you to be aware of that concept that the goals are pretty much the same, but they're very, very descriptive now 20 years later. They were pretty basic in 2000. Okay. Okay. Okay, so that's what I want to cover. Okay. So that's it. That is the final 8 chapters. Okay, to cover for exam 3. Right? Next week is an exam week. Right? And then week 10 is our HESI review. So that concludes all of the chapter content for the term. Okay. So a couple of things. Well, everybody, let's pull up our attestation questions for week 8, please. Let's do that. But while you're doing that, in the meantime, so next week will be exam week. And then week 10 will be our HESI review. And I've already explained to you guys that in each lecture that week, we'll be doing a HESI review. You have to go to your scheduled class, which is now with me, but you'll have the opportunity to go to any other professor's classes in addition to your own scheduled classes in week 10 to do HESI reviews. Everybody will be doing a HESI review that week in all the 12 sections. Okay. How do you feel about community health now? Do you have a better understanding of public health nursing, community health nursing? What do you guys think? Now that you're more awake, what do you guys think? Have you learned a lot? Is it interesting information?
I would say now that I'm awake, I have learned plenty more.
Over the term or just today, Andres?
No, over the term and today, I would say. I have a better understanding of the overall picture of community health.
Yeah. It's a big umbrella. What else? Anybody else have any feedback? Okay. All right. No feedback. Okay. I'm gonna stop sharing or stop recording.